ARASH here with Balance PT. I want to talk to you guys today about mastery, clinical mastery. What is it? Why is it a worthy thing to pursue, and how are you going to pursue that? So we have a clinical residency. This is coming up on our second class. We're coming to accreditation this coming October. That decision will be there. Going into our second class, our goal is the same. We want clinical excellence. We want to push our residents to be better from where they are now. And we want to do it in an efficient way to get you to a master clinician. So what is a master clinician? This is somebody that, one, you understand all the literature, the clinical practice guidelines that are out there through JOSPT and the various organizations that give you the accumulation of research. These clinical practice guidelines, you got to understand what these are. We're talking about 300, 400, 500 peer-reviewed articles with treatment recommendations, diagnosis recommendations. So you want to understand the breadth of research and the knowledge that has accumulated over the history of our profession. This is important in your clinical reasoning, evidence-based practice, right? So in this residency, you're going to get the most up-to-date clinical practice guidelines. The second part is, what are we teaching physical therapists on the most fundamental levels of biomechanics, anatomy, physiology, neuroanatomy, all these fundamental building blocks. This knowledge will be revisited and also firmed up through the residency, right? Do you really know your anatomy? Do you know your neuroanatomy? Do you understand when someone has a pain in a certain place with a certain movement, potentially what regions could be affected, what tissues? Is it a bursa? Is it a ligament? Is it a tendon? Is it a muscle? Is it a bone, right? So being able to weed through the anatomy is extremely important. So with the residency, you get all the evidence base, you get revisiting to really iron down your fundamentals. The third aspect to be a master clinician is learning from others, right? Learning from patients. So let's say you're a new grad, you haven't seen any patients on your own yet, or maybe through an internship. Having a mentor in a weekly rotation, in our residency, we got 50 plus years of experience between 4 mentors. So you think about the pattern recognition, the ability to say, okay, I've seen something similar like this in a similar demographic with a similar type of mechanism of injury, right? So if you don't have that yet, you can speed that up by getting mentorship from those around you, right? To open up and fast track that development. So those are very important aspects, but why do we even want this? And this is another part of our residency, is to professionally, personally develop you as a person and as a professional so that you can be there with your patient, to look them in the eyes and to be able to understand exactly what they need so that you can just work effortlessly through your process. You know what they need clinically, right? So that you can be present with them as a person and being able to, in the literature we call therapeutic rapport, therapeutic alliance, being able to build that connection with the patient and being able to be there with them. And you already know what they need on the clinical side, right? So your focus can be with them as a person, right? So therapeutic alliance is very important, and various tools to be able to bring out of people what they're looking for and their goals. Do you use motivational interviewing? Do you know how to listen and appropriately reflect what people are saying, right? So there's many layers to being a master clinician, but the goal is that you can just run through your day effortlessly with patients because you've seen most of the things that are going to present. And then you can focus on this person on whether it's, a poor behavioral pattern, a self-limiting thought process, whatever it may be, you can hone in on that, right? So when you get to master clinician, you will start to really change people's lives and you'll be able to be there present to help them see where their inadequacies are on the physical side, right? That is our job as physical therapists. We're not just identifying all the things, in the textbook, but we're also figuring out where are these poor behavioral patterns. It could be biopsychosocial limitations, whatever it may be. We're trying to combine all these things so that you can give the patient the most effective treatment to change them, one visit at a time. ARASH with Balance PT. Check us out on Balance PT Move. Take care.